we have an awesome guest for you this evening, if you're watching it in the evening, or we can say this afternoon or this morning. Dr. Brandy Howard, chiropractor.
That's right.
Ladies and gentlemen, sisters and brothers in Christ, this young lady is phenomenal. What made you get into this field?
Well, when I was an undergrad, I was originally going to go to school to be a medical doctor, and I ran into a friend of mine who was going to chiropractic school, so he kind of started telling me a few things about it, and it sounded kind of interesting, so then I went and did my research on it. I did some volunteer work at a chiropractor's office, and I saw what they did, and it was, it made a lot of sense, and he really talked to me as he was working, and from that volunteering experience, I figured, I'm like, okay, this is the kind of doctor I want to be, because it just made sense. I mean, his patients were getting better without using drugs or them having to have surgery, and so it just clicked for me, and that's what I wanted to do.
I noticed in your bio you went to college in Missouri.
I completed my undergrad at the University of Illinois in Champaign, and then I went on to chiropractic school in
Missouri?
In St. Louis, Missouri.
Okay.
Yeah.
And you have your own private practice in
I do.
The suburbs?
It's in North Riverside.
And is that part of Palazzo Township?
I
guess it is.
Yeah.
Yes.
Okay. So.
And how long you been in? Is it a family practice?
It's just me. I'm the only doctor in the office.
Okay.
It's Howard Family Chiropractic it means it's family oriented. So, where I see patients anywhere from babies to, the whole family, grandparents. So it's family oriented. I'm the only doctor in the office, and it is located in North Riverside.
Now, when someone look at you, they say, wow, you are so young.
Mm-hmm. I'm not that young. But it works.
Okay. Now, let me ask you this question, because our audience is Christian-based.
Mm-hmm.
Now, look into your camera and tell the sisters and brothers in Christ why they would need to see someone of your caliber.
Okay. Well, chiropractic is based on the foundation that the body was made to heal itself, and basically, when God made this body, everything was meant to be able to work. So when we do various things that can cause our spine, which I have right here, can cause the bones in our spine to move out of place and end up putting pressure on your spinal cord and on these nerves that come out, and that can cause all sorts of problems. So basically, just let me explain how this works. This is our spinal column here. This is the back of your skull here. Your brain is sitting in here. And coming off of your brain through this hole that we all have in the back of our skull is our brain stem. And your brain stem turns into your spinal cord, and it runs down through the entire length of your spine. Coming off of your spinal cord, you have these spinal nerves here, these yellow nerves, and they're cut off here, but they're actually like telephone wires, and they go to every single part of your body. They go to every organ, muscle, cell, blood vessel, gland, tissue, skin, everything. And this is how your brain tells your body how to work. So through various things that we'll do, these bones will move out of place and get stuck, and you can end up having pressure being put on the spinal cord or these nerves coming out here. And so that pressure is similar to like, stepping on a water hose, where the water's not going to be able to flow freely out. The same concept is going on here. If there's pressure on these nerves coming out off of your spinal cord, you're going to have an interruption of the communication process from your brain out to your body. So depending on where there's pressure at, you can have different all sorts of problems, anywhere from pain to allergies to asthma to eczema, all sorts of things, depending on what system there's interruption going to that organ system. So you can have all sorts of problems from these bones moving out of place.
That is awesome.
Yeah. So it's really important, to get your spine checked and, to find out if there are bones that are out of place and putting pressure on the spinal cord and nerves, because it could be causing problems that, that you are suffering
from. Now,
from.
we're beginning to find out that a lot of people have a lot of back pain. And is there a particular reason why so many people in our country are coming up with back elements and just maybe they pick the boxes up the wrong way? And
yeah, well, there can be various reasons why people have different types of back pain. It can be from an actual injury that somebody does sustain, or it can be from things that we've done over our lifetime, which cause damage slowly over time, and then one day it all accumulates, and then one day your body just gives in to the problem, and then you suffer some kind of where you can't stand up, or you can't bend over, or you can't turn, and it just kind of accumulates to that point. So those are the reasons.
Why is it that I'm hearing out there that there are a lot of people having back surgery? They're having disc problems in their back. Could you explain what creates some of these type of problems with the disc?
Okay, well, the process that I explained with the bones moving out of place is actually called subluxation. So that's when the bones move out of place and end up putting pressure on the spinal cord and the nerves. This in turn causes problems like blown discs, or sciatic nerve is a very common one. And a lot of people tend to have surgery because they feel this is their only option. They go to their medical doctor and they'll give them like painkillers or muscle relaxants, things like that. And then if the problem still is there, then the next course of action would be surgery in their minds. And so people kind of view surgery as the last resort, and this is what I have to do to get out of this pain, when in actuality chiropractic is an option for you. If you're suffering from any sort of back pain or any other problems, chiropractic can be the solution to the problem.
It can be the solution to the problem.
Right.
Now, would you say in most cases? Well,
that would be determined once the patient comes into the office, and we do a complete consultation where you tell me more in detail what's going on with you. We do a complete chiropractic exam, and then if I need to, I'll take x-rays. And then that can give me more of an idea of what's going on with you and if you are a candidate for chiropractic. But anytime when you're considering surgery, that should always be the last alternative, because you can't correct or you can't change. Once they've done surgery, you can't change that. So, you should try all things before you resort to surgery.
Have we done in our country here in America? Have we done a good job in teaching people the correct way to sit up or lift things that could cut down on some of these injuries?
Actually, not up until now we haven't, because people really haven't thought of not chiropractic, but thought of our spine as being something that we should really take care of. It hasn't been something that's been really stressed like the dentists. They've gotten to the school systems,
but that even took almost 10 to 20 years.
And that's the thing. It takes time to get people. It took time for them to get it across to people that, look, you need to take care of your teeth and your gums if you want to keep them. And, they've taught us since we were, little kids now that, you need to brush and floss and see your dentist. And so, chiropractic is growing. And so the influence is growing, across the world on the importance of taking care of your spine, because it's not only taking care of your spine, but what it is actually preserving your nervous system, because like I said, the nervous system runs down through the spinal column. So actually taking care of your spine is taking care of your nervous system, which controls your whole body.
Now, I was in a meeting with you and you gave a fantastic presentation. Now, in understanding this whole mechanism about the spinal cord and the back, what can you, when you look into the camera and you talk to the audience, what can you actually tell them, some pointers on what they can do at home or a correct way to sit to take pressure off their spine?
Well, there are a lot of things that you can do on your own to help take care of your spine. Of course, you want to find out if there is subluxation or if there are bones out of their normal position. You want to first take care of that. Once you correct that, then you want to maintain the correction that's there, or maintain the health of your spine. And you can do that by doing things properly, like getting out of the bed.